Hello everyone, this is Dr. Moada and I will start an ECG course. Hopefully you find it useful. So let's get started. So what is an ECG or EKG? ECG stands for electrocardiogram or electrocardiograph. It's basically the paper recording of the electricity of the heart. The conduction starts from the pacemaker in the right atrium and flows throughout the heart. The ECG shows if the heart is beating fast, tachycardia, or slowly, bradycardia, or the heart muscle has been damaged, like in myocardial infarction. If the patient is complaining of chest pain, syncope, palpitation, dizziness, you should consider an ECG. So how do you record an ECG? To record the electricity of the heart, you need some electrodes, which are placed on the chest and the limbs of the patient. These 12 electrodes will show the heart in horizontal and vertical planes. V1 to V6 electrodes will be placed on the patient chest horizontally, while AVL, AVF, AVR, lead 1, 2, 3 will record vertically. Whenever you hear the word lead, it means a view of the heart and it requires 2 electrodes. Here are some tips for recording an ECG. Start by making sure that the patient is warm and relaxed. Write your patient's symptoms and blood pressure on the ECG. Before starting, make sure that the speed of the paper is 25 millimeters per second and the voltage is okay. Always check your patient name and the date. Placing the limb electrode is easy. Find the least hairiest area, anywhere from the shoulder to the wrist for the upper limb, and anywhere from the lower abdomen to the right or left foot will be fine. To record the limb electrode, always remember to ride your green bike. R for red and right arm, and then place the other clockwise. Right arm, left leg, right leg. Y for yellow, G for green, and B for black. Let's remember some ECG physiology. The conduction starts at the sinoatrial node, which is basically called the pacemaker. The electricity flows throughout the atrium, reaching the atrioventricle node. Here, electricity delays for 0.07 seconds. After that, the conduction reaches the septum, and electricity flows throughout bundle of fibers called bundle of Hess. This makes the ventricle contracts from the apex to the base. After that, the heart relaxes, reaching an isoelectric phase. Each one ECG has 5 components, and it resembles a heartbeat. On ECG, the P wave represents atrial depolarization. The delay is represented by the PR interval, where QRS complex records the ventricle depolarization. The ST segment is an isoelectric phase where the ventricles are completely activated. The T wave represents the repolarization of the ventricle, when ventricles go into resting electrical state. Always remember, the more ECGs you read, the better you will get, so always practice. Always start by looking at the patient, measure their pulse and blood pressure. Do they look unwell to you? If the ECG does not fit your clinical expectation, check the machine's setting, the speed, and the voltage. Remember, if your patient is unwell, always seek help immediately. When your patient is stable, you can do more assessment. Always approach the ECG the same way. Remember this: RRPWQST. RRPWQST. Check out your patient heart rate and then the rhythm and then the P wave. Is it before every QRS? W stands for width of the QRS complex. The normal width is less than 3 small squares. Q stands for the Q wave, and S stands for ST segment, which is an isoelectric phase. ST segment is essential in diagnosing myocardial infarction. T stands for the T wave. I will explain each step in details. R for heart rate. The closer the QRS complex is, the faster the heart is beating. If the rate is regular, divide 300 by the number of large boxes. When the heart rate is over 100, this is called tachycardia. And when the heart rate is below 50, this is called bradycardia. The second R is for rhythm. If there is the same number of squares between each QRS complex, then it's regular. If the number of squares is not the same, the rhythm is not regular. P stands for P wave. You should check if it appears in a sinus rhythm. This means that P should appear only once before every QRS complex. If there is no P wave, or there is multiple P waves before the QRS, then the rhythm is not sinus. Multiple P waves before each QRS is called a heart block. W stands for the width of the QRS complex. If it's more than 3 small boxes, this means a delay in the contraction of the ventricles. This is caused by bundle branch block or hypertrophy of the muscle, or a spontaneous electrical impulse starting from the ventricles. This is called a prolonged QRS complex. Check out this example to practice. What is the width of the QRS complex? We should count the small boxes. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. There are 10 boxes. QRS is prolonged to 10 boxes instead of 3. So remember, RRPWQST. So we are reaching the Q wave. If the QRS complex is starting with a deep Q wave, like here, this may lead to myocardial infarction. Again, RRPWQST. S stands for ST segment. The word segment means that the period is isoelectric. If the ST segment is elevated, this leads to myocardial infarction. If the ST segment is depressed, this leads to ischemia. T stands for the T wave. If it's upside down, it leads to heart disease. It's normally inverted in V1 and AVR.